This is Kathy from Wellspring Clinic in Vancouver, Canada. So like yesterday, I interviewed one of the patients from the States. So he shared some of his progress to treat here. And some people may be wondering how he could come into Canada. So today I want to share some procedure with this patient from the States. So maybe you could share with us what's the process? How could you get in? What the board asks and what documents you have to prepare?
So I had to prepare in advance a number of documents that I thought would help. The first was my formal request for medical leave from my employer. It's the application that Wellspring fills out and that I send to my employer so that they can grant me medical leave. The second document that I brought is also a document from Wellspring. It's the one where you explain at the top with your business logo and phone number and full contact information what RP is, and then you had my detailed patient information, my date of birth, my full name, and you're familiar with that form, so
yes,
you know that one.
Yeah, we write a lot of these letters.
Yes, because
for people to apply the visa before. People from other country, they apply visa, we provide this letter.
Yes.
Sometimes it helps you.
And I think that was the document that the agent looked at most closely. They went to your website that was on that piece of paper to really check in to the situation. And then I also brought my formal document from my employer that released me for medical leave. I wanted these 3 documents to tell the full story of exactly why I was coming, to prove that I was not coming for tourism or this is for health reasons,
for medical purposes.
Yes. And then I also brought my hotel reservation, and this is important for quarantine. There's also an app called Arrive Can for anyone coming in to Canada, and they ask you about where you're going to quarantine. It's just very basic information.
I see.
But I also brought my hotel reservation to show that the dates that I was going to quarantine, where I was going to quarantine, and then also the dates from the doctor, your office, showing when my first appointment would be starting the 3rd week, so that they could understand exactly, that I was committed to quarantining 2 weeks and then starting the next day for first appointment.
I see.
One other, and then also the flight reservation, sometimes they've wanted to see that to make sure I'm coming and leaving exactly when I say. All the dates need to match.
I see, so more detail, right?
Yes.
Yes, more detail. So for this patient, as I mentioned yesterday video, this is his 6 trips. The first 4 trips not had much improvement. Then the 5th one, we tried to change from 2 weeks to 3 weeks.
Yes.
And then began to see some improvement. And then, so before these 6 trips, because the Covid-19 takes longer to come here. But after first week treatment, you almost get back to what you lost this past almost a half year, right? From February to, more than half a year.
I noticed a faster response, so that was very good to have it the first week instead of the 3rd.
That's great.
Yes.
So we feel so happy for you.
Thank you.
So he's the only one that make the trip to come here during this special time, and also we feel so happy that he do had some progress, and even had some breaking progress but not stabilized yet. But we do see the hope.
Yes.
Yes. Okay.
And I had just one other comment that might help make it easier. The documents that I described, it also helps before you board the plane to Canada to show the airline attendants in the US your documents, because they also need to verify that you have that it's not for tourism, that you have some special reason to come that they can see before they let me board the plane, even before I got to Canada. But they reviewed the documents I described, and they said, okay, you should be good because it's medical.
Oh,
so they let me get on the plane.
I see. They probably already know that probably have greater chance to get allowed to get in.
Yes,
right?
other's I don't think
they will not
would've-
let you
right.
boarding.
Because when you try to board to Canada, they say unless you meet certain requirements, let us know so we can help you make return arrangements to go back where you came from.
Oh.
So when you hear that warning at the gate, that's when I went up and said, okay, here's my documents. And
see.
she said, okay, thank you. And
I see.
then I was good.
Okay.
So that's very important.
Okay. Such a long journey, but
Yes.
finally we make it.
Yes.
Yes, and hope after this trip, then maybe in 3 or 4 months could make another trip again.
I hope so.
And to have another treatment.
Yes.
Yes. So good luck to you.
Thank
and
you.
Thank you for your interview.
Certainly.
Okay.